In this video, I'll delve into a pressing issue resurfacing in 2024, one that could significantly affect people nationwide. If resolved, it could mean an $800 payment for approximately 65 million Social Security, SSDI, and Medicare recipients. In this video, we'll address a critical issue resurfacing in 2024, potentially impacting millions nationwide. If resolved, it could mean an $800 payment for around 65 million Social Security, SSDI, and Medicare recipients. Stay tuned as we delve into this important topic and provide updates on the current situation. Again, it's all about you, and that's what I want to bring to your attention here in this video, as well as what they're talking about as of right now. And as you heard me say just a minute ago at the beginning of this video, if they can get this thing done this year or relatively soon, then that's going to impact everybody. However, if they cannot, the concession is a one-off $800 check for about 65 million people that receive those fixed income benefits. So it's like, do you want it to impact everybody, or do you just want the concession of the $800 check? And again, I'll explain all of that here in this video. And what they're now talking about, it all comes down to one big idea, which is Medicare expansion or Medicare for all. Okay, let me explain the details about this really quickly, and then this will all roll into this whole concession of the $800 check. I know it seems kind of weird, but let me explain the details about this all right. So here is what is coming up yet again. We've been hearing about this for a few years now. They want to do Medicare for all, as in they being lawmakers. All of them? No, not all lawmakers, but some of them, in fact, couple hundred of them want up Medicare for all. Okay, however, here's the situation with this Medicare for all. It is a major situation. In other words, they want to replace basically all private healthcare with basically just one system, which would be Medicare for all, like what we've seen in other countries that are out there right now. They're basically saying that United States has a very broken healthcare system, and they want to replace it with Medicare for all. In other words, a single payer program. We all have Medicare is basically what they want us to do. Right? Well, as a result of this, it would cost tens of trillions of dollars, and it would be a major deal to get through lawmakers. Okay, it would take a very long time, and they recognize this just as much as we do. But they're bringing it up yet again and saying this is a hot button issue, and we need to get this reformed. We need to get this figured out now. Here's the thing, in my honest opinion, based on what I'm seeing out there, Medicare for all is not going to happen this year. In fact, it won't even happen for the next few years. It will be a very long process and a long road. However, in the event that they are unable to get Medicare for all implemented, this is what they want to do. So, even if they don't get this going, it will take years to get it passed through Congress and implement the entire thing. Medicare expansion is now here. Here's the thing. There's about 65 to 66 million people currently enrolled in Medicare as of right now. Well, we know that Medicare is somewhat limited. They don't pay for everything right now. Here's what they want to do. They want to expand Medicare to include hearing, dental, and vision. Now, here's the thing. They've also been talking about this for a couple years as well, right? They've been mentioning this, and they've been saying this is very important. If we cannot do Medicare for all, we should at least include basic services like hearing, dental, and vision, right? Covering all these things that are very expensive, and a lot of people that are enrolled in Medicare need these services. Okay, now here's the thing. As they continue to walk through the details of Medicare expansion right here, including these different services in there, they continue to find that, wait, well, some of these services we can easily add, like hearing and vision. They're thinking, okay, these are probably going to be added, no problem whatsoever. They can be expensive, but again, we'll make it up. Don't worry about it. Well, get these added in there. But then it comes down to dental. So here's what it comes down to basically, as they walk through the details of adding dental coverages into Medicare, they all continue to basically come back and think, hey, this is way too expensive. we simply cannot add dental services into Medicare expansion. So here is the concession, and this is where the $800 one-off check comes in okay. So basically what they want to say is, as a concession of not adding dental coverages into Medicare expansion, we want to send out all 65 to 66 million Medicare beneficiaries a one-off $800 payment that can be used for dental now. Here's the thing, that is what their idea is, to send out a one-time $800 one-off concession payment for dental, okay? So the whole purpose behind this would be you're supposed to use the $800 for dental. Now here's the thing, I've seen it presented in a few different ways. Some have proposed creating a prepaid card that can only be used at dental offices. Others have proposed giving the 66 million beneficiaries a one-time $800 check that they can use for dental care. However, how can they be certain that we are actually purchasing dental care? This is the thing that says we can't use it to purchase food. I'm not sure about you, but that's kind of like dental, right? Like stretching the rules just a little bit. I'm just saying, right? It's a little bit dental related. You know you're probably going to chew a little bit, therefore it's dental, right? Who's going to come back and track all this? But my point is, this is what they're talking about, okay? So when it comes down to this whole Medicare expansion, Medicare for all situation, this is what they're discussing in okay, now Medicare expansion would be a much easier feat to actually push through, and this is something that is probably a lot more reasonable before this Medicare for all situation comes into play, right? But again, we'll have to see how this whole thing shakes out, and this is something that continues to come up. Why do they do this? And especially, why would this year be so incredibly important when it comes down to Medicare for all and Medicare expansion? Obviously comes down to the elections later on this year, right? Because here's the thing, lawmakers know that sometimes things won't get done, as in they know when they bring a piece of legislation to the floor, it may or may not get done. Then why would they do it to put other lawmakers on record of who would support it and who would not support it, right? So then they can all point the finger and be like, look, he doesn't want to support it. They don't want to support it over there, right? So they do this stuff on purpose so that we can all see, us, the people, the public, we can see who is in support and who is not in support. Does that make sense, right? So that is why they talk about this. But realistically, in all honesty, I don't know why this wasn't done earlier. I understand that everything is expensive, especially in light of the events of 2020 and 2021. The cost of everything is insane. However, my point is that, in my opinion, it makes perfect sense to include basic services like hearing, dental, and vision coverage in Medicare. What is it that the majority of Medicare beneficiaries require on a regular basis? New glasses, perhaps occasional hearing aids, dental work. I'm not sure that would seem to be a reasonable place to start. They're discussing the possibility of a one-time $800 payment, possibly for dental care, with various payment methods available. However, there's debate about tracking its use for dental purposes. Stay tuned for updates on this evolving topic, as it's unclear if it will materialize. Remember to subscribe for future updates, and take care until next time.